I believe we would all agree that it has been 18 long months of overwhelming information that is challenging to sort out and understand. I'd like to review a few things that we do know and don't know. We know that vaccines are safe, they work, and they save lives. As a pediatrician and a parent, vaccination is one of the most important interventions that I provide to children. We have safe meningitis vaccines. We rarely see children permanently damaged by meningitis. We have safe chickenpox vaccine, pneumonia vaccine, whooping cough vaccine, and many others. We no longer see children miserably infected by these diseases, and parents stretch thin and stress with the care of those sick children. COVID vaccine is no different. We know there are minor side effects in the vaccine. We know there are frightening cases of blood clots, but we know that these are extremely rare. We know there are cases of heart inflammation. This too is extremely rare, 1 in 20,000 doses of vaccines versus roughly 1 in 40 cases of heart inflammation in young adults who are infected with COVID, many seriously sick. Getting vaccinated against COVID is simply much, much, much safer than getting sick with COVID. Vaccines have been around for 200 years. There's not one vaccine that causes side effect that was not seen within a few months of the vaccine being given. No other vaccine has been so studied as the COVID vaccine to ensure safety. We know that being unvaccinated puts a person at risk for getting COVID. We know that COVID infection can kill. We know it can leave long-term consequences. We know that the overwhelming majority of hospitalized patients right now are younger and unvaccinated. We know that the risk of severe disease and death is greatest for those most vulnerable among us, the elderly, the very young, people with health conditions such as diabetes and obesity. What we don't know is among those of us who are younger and healthy, which of us will become severely ill if infected by COVID? We don't know why some people get infected and show no symptom, and others end up in the intensive care unit struggling to survive. We know this coronavirus is a moving target. We know new strains have come along, and we know just how incredibly contagious the current Delta variant is. What we don't know is what other variant is lurking around the corner. Let's protect ourselves and our children. Once again, getting vaccinated against COVID is simply much, much safer than getting sick with COVID.